Greetings, Professor Dillman and classmates. This is Adina Mitchell, and today we're going to talk about the Affordable Care Act. We're going to take a closer look at the benefits and shortcomings and alternative policies moving forward. First, I'll provide a brief overview of what the ACA was created to do. I'll give you all some background information on the implementation process. Then I will provide details on the summative evaluation performed that will highlight the changes in insurance coverage and analyze the policy's benefits and drawbacks. Then we will analyze various practices of international universal healthcare coverage. We will look at some ACA policy alternatives, and then I'll make some of my own policy recommendations. I just want you guys to get ready to think about universal health care in a whole new way. The Patient Protection and the Affordable Care Act is often referred to as Obamacare. For the sake of this presentation, I will simply call it the ACA. Anyways, it is the most important healthcare legislation passed since the Medicare and Medicaid programs were created in 1965. ACA expands access to health insurance and slows down the rate of growth in Medicare spending. According to healthcare.gov, some of the benefits of healthcare coverage under the ACA include requiring insurance plans to cover people with pre-existing health conditions, providing free preventative care so you can get your checkups more regularly, holding insurance companies accountable for rate increases, making it illegal for health insurance companies to cancel your health insurance just because you've gotten sick. It protects your choice of doctors and provides other services like mental health and substance abuse assistance. So how does such a controversial law like the Affordable Care Act make it through Congress? Let's discuss the implementation process. So let's start at the beginning. President Obama was not the first president with an agenda to reform the U.S. healthcare system. Past presidents have tried and failed, including President Harry Truman, President Richard Nixon, President Jimmy Carter, and President Bill Clinton. President Lyndon Johnson was successful in reforming healthcare in 1965 with the enactment of the Medicare and Medicaid programs. So how did President Obama successfully overhaul the entire U.S. healthcare system? By doing the opposite of what Bill Clinton did in the 1990s. For instance, Clinton moved slowly in pushing legislation, while Obama worked quickly. Clinton provided a very detailed plan on the changes he wanted to implement, while Obama left several details up to Congress. Clinton's policy required all employers to provide health insurance to their staff, while Obama's policy exempted small businesses. Clinton wanted to create a healthcare plan that would not require the creation of new taxes to fund it. Obama, on the other hand, was content with taxing the wealthy to pay for the plan. Obama went out of his way to enact policy that neutralized stakeholders, while Clinton battled with them head on, leaving him with much more opposition. When President Obama was elected, his party held majorities in Congress with 59 senators and 257 congressmen in the House of Representatives. President Johnson had a much larger majority when he enacted Medicare and Medicaid. President Obama's majority was similar to President Clinton's in the mid-1990s. When former Republican Senator Arlen Specter switched parties in August 2009, Democrats now held a supermajority and can override a Senate filibuster. In 2009, the federal budget deficit was high following the Depression due to bailouts and stimulus legislation under the Obama's administration, meaning whatever they did had to make sense budget-wise. This likely limited the scope of the Affordable Care Act, as being budget conscious was a priority. This could have also increased the public's willingness to accept an expanded healthcare program, as a large portion of the population were adversely affected by the Great Recession. Since the ACA has been signed into law since 2010, 9 years later is a good time to evaluate the positive and negative aspects of the Affordable Care Act, as several years of data have been collected. So let's start with some of the positives. According to the Center on Budget and Policy Priorities, 20 million more people have health insurance coverage under the Affordable Care Act. This chart shows the decrease in the percentage of Americans lacking health insurance. The first initial drop took place in the 60s and 70s, immediately following the implementation of Medicare and Medicaid. After 2010, you can see the number beginning to decrease steadily until 2014, when the second major drop took place after the ACA was expanded to make Medicaid more inclusive. According to the Henry J. Kaiser Family Foundation, the Affordable Care Act coverage expansions provided an opportunity to increase coverage and address longstanding racial and ethnic disparities in health coverage. Prior to the ACA being implemented, people of color were much more likely to be uninsured than whites. The chart above depicts the percentage of non-insured by race. As you can see, all races saw a decrease in individuals not covered by health insurance. Research suggests these gains will likely lead to reductions in disparities in access to and use of healthcare, as well as health outcomes over the long term. More healthcare coverage means better access. Americans are making better choices for their health without the added burden on how that will affect their monthly budget. Take a look at some of these numbers. 27% more people got prescriptions filled under the ACA, meaning medicine is more affordable. 24% more people showed up for tests or treatment, showing a decrease in out-of-pocket costs for certain medical procedures. More low-income adults are seeing their doctors more regularly and utilizing preventative care measures. Individuals with chronic conditions are getting treated more regularly, which leads to a reduction in depression and improvements in diabetes and hypertension, and allows diseases like cancer to be detected at earlier stages. Please note that the benefits of the ACA extend beyond healthcare. When healthcare is more affordable, an individual's financial security can increase. The average individual had a $1,140 reduction in medical debt, and with less debt, those individuals were able to secure lower interest rates for mortgage and auto loans and possibly even credit cards. So now let's talk about some of the drawbacks of the Affordable Care Act. There are still an estimated 23 million Americans without health coverage. Although costs are lower, the plan lacks a reliable way to effectively control those costs. Some Americans that already have health coverage are not allowed to join the new insurance exchanges. Major coverage provisions like Medicaid expansion, state insurance exchanges, and federal subsidies to purchase private insurance did not even begin until 2014. This strategy was likely intentional, as it kept the initial cost of the ACA under $1 trillion. According to Physicians for a National Health Program, the ACA has missed the mark in several ways. For starters, making patients consumers in a marketplace makes the assumption that those in dire need of care will have the ability to pick the best plan. Although the ACA limits some pricing mechanisms of insurance companies, things like medical management is classified as healthcare, meaning insurance companies can still spend unlimited amounts of money funding bureaucracies. This also means that insurance companies in the marketplace have higher than expected costs. The government will subsidize part of the cost on their behalf. There is no policy in place to control overall healthcare costs, and resources spent on healthcare are diverted from other important public goods such as education, infrastructure, research and development, and public safety. The ACA does not contain any proven economic policies to significantly roll back overall health expenditures. Gaps in ACA prevent federal savings, as programs like CHIP will still exist as recipients make too much money to get lower rates through ACA. Since ACA depends on the existing commercial health insurance model, rural residents generally have to pay higher premiums. The ACA marketplace is based on an internal revenue code, and definitions of income and household, meaning this is a very complex process for the average American. So let's take a look at some of the international universal healthcare policies and practices. Democracies with some form of universal healthcare coverage is quite common, with the United States as the only Western democracy that lacks a truly comprehensive healthcare system. Countries like the United Kingdom, New Zealand, Canada, the countries in the Nordic region, the countries of the Iberian Peninsula, Italy, and Taiwan all have universal healthcare systems, even though they operate in various ways. Several other countries, like Germany, also operate universal healthcare systems, but the countries mentioned here all operate in a way that is comparable to America's understanding of what a single-payer healthcare system is, meaning each of these countries have universal systems with government accountability and price controls. Strong and unified central governments means there are less opportunities for opposing interest groups to block legislation. Historically, single-payer systems are also established in critical political junctures when a country is democratizing and has no universal healthcare system. In Taiwan, for example, as they became a newly formed democratic state, there was a blank slate for the creation of a simple, egalitarian, all-inclusive program. The U.S. is a hostile country to establish a universal healthcare system for these two reasons. One, the U.S. does not have a strong unified central government. There is a large number of political players that can block legislation. It is easy for opposition groups to find a way to veto initiatives. Two, the U.S. did not become a fully inclusive democracy until the passage of the Voting Rights Act of 1965. Meaning, when conversations about healthcare reform were taking place, a large portion of the U.S. population was not included in those conversations. Programs that serve the middle class and poor are much more likely to survive and thrive than programs that serve only the poor. Almost every system has let the rich buy out in one way or another, meaning creating a system that the middle class will support and not buy out of is important. Hospital organization is also crucial, as the public system should finance expensive hospitals, meaning the best services will remain open to the public. Teaching hospitals will also play an important role as well. In the Italian system, egalitarianism was the driving force behind the creation of the Italian National Health Service, established in 1978. The egalitarian principle of healthcare states that healthcare should be financed according to the ability to pay, through general taxation, but distributed according to need, making things more equitable. It ensures universal and inexpensive access to a comprehensive package of health services. However, in Italy, the egalitarian approach has reduced the trust of its citizens in certain healthcare services, as long waiting lists for free services have driven the middle class to the private sector. During the 2.5 years I had the opportunity of living in Rome, most of the Italian citizens I knew were used to waiting up to 3 years for a dental visit and not receiving much prenatal care while pregnant, as that was the price for receiving free services. My family visited an emergency room once while we were there, and it was one of the least complicated processes we'd ever experienced, as very little paperwork is involved compared to an American ER. However, the facility was crowded and a bit run down, and a little older looking. When a family member had a procedure done that required an overnight stay, we opted to use our insurance to go to the more exclusive hospital, which was completely different than the public hospital we had seen before. It was located on a more affluent side of town and honestly was a lot more state of the art and just nicer as a whole. Italy's missteps is just an additional proof that creating a program that caters to the middle class and ensures that all hospitals, especially the expensive ones, have a buy-in to the universal system is crucial to successfully implementing universal health care. With several individuals still vying for a bid as the Democratic presidential candidate for the 2020 election, healthcare for all has been a top priority for the Democratic Party. But what is the political feasibility of actually expanding healthcare coverage? And what would the impact be if the ACA was ever amended or repealed? The most liberal candidate running for the Democratic nomination is Senator Bernie Sanders. Although Mr. Sanders supported the ACA, he does not believe the policy went far enough in providing adequate health care for all. Mr. Sanders' policy proposal promises that investing in a single-payer healthcare system through increased taxes would ultimately reduce out-of-pocket expenses for healthcare. Mr. Sanders wants to increase access and choice by allowing patients to see the doctors they want with no out-of-network limitations. He wants to increase quality by providing primary preventative care, mental health care, reproductive care, and etc. He wants to reduce prescription drug costs, eliminate out-of-pocket costs, meaning no premiums, deductibles, or copays for any medical services. He wants to empower people by separating health coverage from employment, so everyone will have more flexibility to change employers or even consider starting their own business without the risk and fear of losing their health benefits. In the Medicare for All system, every American will be automatically enrolled into the health care plan. Bernie's proposal would amend the tax code to create the American Health Security Trust Fund, which would be financed by various tax revenues, credits, and subsidies. Claims that Medicare for All would save $5.1 trillion have been made by Bernie's campaign. In an opinion piece for the Milbank Quarterly, the author argues that more radical approaches to healthcare reform would only work if on January 1st, 2021, the Democrats controlled the White House and had governing majorities in the Senate and House. Instead of a radical change, Democrats should instead support a more modest version of reform. In particular, the Consumer Health Insurance Protection Act proposed by Elizabeth Warren, or the Healthy America program proposed by the Urban Institute. Warren's act would improve affordability and reliability of health insurance in a more durable and expansive way than the ACA. It would address the gaps in the act by capping a total cost of premiums to 8.5% of household income. It would limit prescription drug costs to $250 a month for Americans with private insurance, and it would also reverse what the Trump administration overturned within the ACA. The Healthy America program would build upon the Affordable Care Act and Medicare and merge the act with private coverage marketplaces with the non-elderly portions of Medicaid and the Children's Health Insurance Program. Based off of our previous assessment of universal health care programs overseas, it may not be politically feasible without a supermajority to pass a universal health care plan in the U.S. It would be wiser to slowly expand a program that is already in place with the goal of achieving universal health care in the long run. The Congressional Budget Office estimates that repealing the Affordable Care Act would have a significant effect on the federal budget deficit and the economy. The ACA's impact on federal revenues and mandatory spending means that repealing the act would increase the federal budget deficit substantially over the course of the next 10 years, as you can see in Figure 1 above. Including the budgetary effects of macroeconomic feedback, the budget deficit would increase by $137 billion. Excluding the budgetary effects of macroeconomic feedback, the budget deficit would increase by $353 billion. Even though the deficit would increase, the government would still save $1,658 billion over the next 10 years by eliminating the federal subsidies for insurance purchased through the marketplace. However, direct spending would increase by approximately $879 billion for reinstating Medicare benefits to hospitals' insurance companies that were in place before the Affordable Care Act. Reducing the tax rate for high-income payers will reduce tax revenue by $631 billion. Employer-based insurance coverage would likely increase by approximately 8 million people, but those covered under Medicare and Medicaid would decrease by almost 32 million within the next 10 years. The number of uninsured individuals, not including the elderly, would likely increase by almost 4 million. So in other international universal healthcare policies, we identified some of the key stakeholders that make their healthcare systems function. So what buy-in do we need in the US to amend or improve upon the ACA? Hospitals and medical professionals. The National Nurses United, pictured here, are just one of the many groups of medical professionals who are willing to embrace a universal healthcare program. From 2008 to 2017, the percentage of physicians who favor single-payer health care increased from 42% to 56%. As most physicians were white males well into the 1990s, they were largely a Republican supporter. As the insurance industry expanded, doctors went from owning private practices to receiving salaries at hospitals. As more women and people of color entered the medical profession, medical schools began to expand their curriculum to cover more social issues. Doctors see the dysfunctional healthcare system daily and have to deal with preset requirements, reimbursements, and administrative costs inflicted on them by the insurance companies. They understand that a change is needed, and many do not believe that the Affordable Care Act has done enough to change these needs. So, what do I think we should do concerning amending healthcare moving forward? Honestly, I've always felt like President Obama compromised too much when passing the Affordable Care Act. He gave too much power to insurance companies, too many concessions to political opposition, and ultimately failed to create a program that was truly universal in its coverage of healthcare. However, after doing this research, I have a better understanding that getting the law passed is where President Obama triumphed. Ensuring that millions of more people, especially minorities, had healthcare coverage is an accomplishment in itself. Repealing the ACA would be irresponsible and only increase the amount of individuals without healthcare without any real economic or budgetary advantages. It would leave millions more uninsured and only expand upon the racial disparities in healthcare that were finally being addressed and beginning to improve under the ACA. Although ideally, I believe that Bernie Sanders' policy is the best possible scenario for Americans at this point in the political climate that we're in. It's just an unrealistic goal. I feel like we should encourage legislators to make the old policy that currently exists better so that eventually it can lead to the creation of a new and more expansive and comprehensive policy where more individuals receive the benefits of affordable health care. Let's take a measured approach to expanding universal health care, like the ACA did, and gradually work towards a universal system that even our political adversaries can learn to value one day. I hope this presentation gave you some additional insight to the inner workings of the ACA, and I truly hope it changed your perspective on what universal health coverage means and how, even though the ACA isn't perfect, it has provided some benefits to many Americans. Thank you.